Hello, I'm Richard Gummel with UHS Surgical Services. Welcome to the My UHS Surgical Services clinical update video on the Joint Commission's Environment of Care standards. This clinical update will focus on how to become compliant with these standards as they relate to medical lasers. The Environment of Care standards are plans that manage specific areas of care within a healthcare organization. The Joint Commission's state-of-the-art standards set expectations for organization performance that are reasonable, achievable, and surveyable. They are the basis of an objective evaluation process that can help healthcare organizations measure, assess, and improve performance. The standards focus on important patient, individual, or resident care and organization functions that are essential to provide safe and high-quality care. Failure to pass a Joint Commission survey can result in citation and other serious consequences. This presentation will include the requirements applicable to critical access hospitals issued in September 2014. These requirements are also associated with the standards related to medical equipment and utility system maintenance effective January 1st, 2015. Now, let's take a look at what healthcare facilities need to do to be compliant with the Joint Commission's Environment of Care standards revisions. Here's Chrissy Reed to discuss the important elements of the standards as related to medical laser system.
Thank you, Richard. The Environment of Care Standard EC 02.04.01 states that the hospital or critical access manages medical equipment risks. To understand what this means, let's discuss the elements of performance a hospital must adhere to for this standard. First, maintain a written inventory of all medical equipment. Second, identify medical equipment on the inventory for which there is a high risk of serious injury or death to a patient or staff member in the event of equipment failure. Third, identify in writing the activities and associated frequency for maintaining, inspecting, and testing all medical equipment listed on the inventory. These activities and associated frequencies must be in accordance with the manufacturer's recommendations or with strategies of alternative equipment maintenance or AEM programs based on the manufacturer's recommendations. The strategies of an AEM program must not reduce the safety of equipment and must be based on accepted standards of practice.
An example of standards for a medical equipment program can be found in the Recommended Equipment Management Program Handbook, published by the American National Standards Institute and the Association for the Advancement of Medical Instrumentation.
Fourth, the activities for inspecting, testing, and maintaining medical lasers must have documented evidence of maintenance and repair history, including records provided by the healthcare facilities contractors. Fifth, a qualified person or persons must use written criteria to support the determination of whether it is safe to permit medical equipment to be maintained in an alternate manner. This written criteria must include how the equipment is used, the likely consequences of failure or malfunction, and maintenance requirements of the equipment.
For more information on defining staff qualifications for this element of performance, refer to Standard HR.01.02.01.
Sixth, identify medical equipment on the inventory that is included in an alternative equipment maintenance program. 7, monitor and report every incident in which medical equipment is suspected in or attributed to the death, serious injury, or serious illness of any individual as required by the Safe Medical Devices Act of 1990. And 8th, have written procedures to follow when medical equipment fails. This includes having emergency clinical interventions and backup equipment on standby.
Standard EC 02.04.03 states that the hospital or critical access hospital shall inspect, test, and maintain medical equipment. The elements of performance for this standard include the following. First, before initial use and after major repairs or upgrades of medical equipment listed on the medical inventory, safety, operational, and function checks must be performed. And second, all high-risk and non-high-risk equipment inspections, testing, and maintenance must be documented. Additionally, Standard EC 02.05.01 states that the hospital or critical access hospital shall manage risk associated with its utility systems. The key elements of performance related to lasers for this standard include the following. First, the elements of performance for utility systems are very similar to that of medical equipment in terms of inventory, risk, inspection, testing, maintenance, and documentation requirements. And second, in areas designed to control airborne contaminants such as biological agents found in laser plumes, gases, or fumes, the ventilation system must provide appropriate pressure relationships, air exchange rates, and filtration efficiencies. Areas designed for control of airborne contaminants include spaces such as operating rooms and special procedure rooms. Please note that local exhaust ventilation equipment, such as smoke evacuators, must also be utilized, tested, and maintained to deal with large amounts of plume produced by laser tissue interactions. There are other environment of care standards and numerous other elements of performance that healthcare facilities need to be aware of in order to be fully compliant with the entirety of the Joint Commission's requirements. Please visit the Joint Commission's website for more detailed information and materials.
The risk categories of an environment of care and emergency management survey include general safety and security, hazardous materials and waste, fire safety, medical and laboratory equipment, and utilities. In past surveys, some hospitals have been cited for lost laser violations because they were not able to locate lasers listed on their inventory. In other instances, hospital-owned lasers were not included in their inventory at all. It is advisable that your organization conducts a mock environment of care session. Richard will elaborate more on this, but first let's summarize the key points of these standards. To begin, there are a number of steps that must be taken to ensure compliance with the Joint Commission's Environment of Care standards. This includes extensive and varied up-to-date written documentation, procedures, reporting and inventory of all equipment and utility systems, including lasers, exhaust ventilation equipment, and controls for airborne contaminants. Additionally, all medical equipment and utility systems must be thoroughly inspected, tested, and maintained for safety in accordance with OEM recommendations. However, alternative methods may be used given certain guidelines. Medical lasers especially must have routine safety, operational, and functional checks performed on them before initial use and after all major repairs and upgrades with documented evidence of results.
Thanks, Chrissy. It is important to be prepared for an environment of care and emergency management survey, as failure to pass a Joint Commission survey can result in citation and other serious consequences. UHS Surgical Services can assist healthcare facilities with a medical laser mock environment of care session by conducting a risk assessment to identify and provide recommendations to minimize vulnerable risk categories. This concludes the clinical update on the Joint Commission's Environment of Care standards. Please click on the Contact Us button if you would like more information on solutions UHS Surgical Services can provide to your facility, or if you would like to leave any feedback related to this site or video. This button can also be used if you have heard of any changes in the industry and would like to share this information with us. On behalf of UHS Surgical Services, thank you for watching, and Iger Primo.